All right, so I'm going to be administering a transdermal patch on my patient today. So right now I am in the med room. So here I am performing hand hygiene. I have my MAR sheet in front of me and I'm comparing the medication that I need to my MAR sheet. And so I'm looking at that I have the right patient, I have the right medication, the right dose, the right route, and the right time. So I'm just comparing that I got everything there. And then I'm also going to be going through the nursing considerations indicated by the Skills Lab medication administration guidelines. So now that I have my transdermal patch that I'm going to be giving, I'm going to be going to the patient's room. I'm going to be knocking on the door, introducing myself. Hi, my name's Emily. I'm going to be your nurse today. And I'm going to be applying a transdermal patch to you and replacing your old one. So I'm going to be washing my hands, performing privacy for my patients, and then I'm also going to make sure that I ask my patient their name and their date of birth, and so then I check that with their wristbands, and I also verify that on my MAR sheet as well. And I'm also making sure that I scan my medication as I'm coming in and make sure that gets put in properly, and then I'm going to be asking my patient if they have any allergies and comparing that to my MAR sheet as well. Then I'm going to explain to the patient the medication that they'll be getting and why they're getting it and ask them if they have any questions. All right, and so then once we're all good with that, I'm going to go ahead and put on my gloves. All right, and then I'm going to be assessing the skin where I'm going to be putting the patch and just kind of making sure everything looks good. Doing any cleansing if I need to, but I'm just kind of looking at the area right here. So because they have an old patch on, I'm going to remove that first. So I'm going to take off the old patch, I'm going to fold it, and I'm going to put it in the sharps container over here. And then I'm going to take a look at the skin and do any cleansing as needed before I put on the new patch. So then with my new patch, I'm making sure that I have the date and the time and I'm initialing it. And then I'm going to peel it off. And then I'm just going to go ahead, once the skin is all clean and good, and I'm going to put the patch right on there just like that in the right location. And then that is it. I'm going to make sure my patient is comfortable, they're in a good position. I'm going to take off my gloves and perform hand hygiene. And once my patient is done and taken care of, and they don't need anything from me and they're in a good position, then I'm going to go ahead and document and report the medication that I gave from the MAR.
Well done.
All right.